Good afternoon, everyone, and welcome to today's webinar. I'm Susan Ryan. I am the Senior Director of the Greenhouse Project, and we are thrilled that you have chosen to spend some time with us this afternoon. So I'd love for you to introduce yourself using the chat feature, which should be at the bottom of your computer. Let us know who you are, where you're from. We are really seeking to establish a virtual community. So really appreciate you introducing yourself there. I want to give a real shout out to our sponsor, Unidyne, and thank them so much for their sponsorship that really is enabling us to be able to bring you this Elevate, Rise Above the Chaos webinar series. So today's session is about one of our core values, and that core value is empowered staff. Elevate, Rise Above the Chaos was really envisioned to really highlight the Greenhouse Project's core values. Last week on the webinar, we had a few questions that kind of came up and people were wondering about the model. So we're introducing empowered staff. It's the first of 2 sessions that will talk about the organizational redesign, just to help you understand a bit more about what is empowered staff. We've got a video, so listen and we'll talk to you about empowered staff. And stay tuned, it's coming, it's there. I think you have to back it up a bit. There we We're gonna start it again. Here we go. We're learning a lot as we go with our technology. Here we go. So hopefully that gave you a bit of an idea of what empowered staff means. So we want to learn a little bit from you. So we're going to launch a poll, and here's the first one. What has been your most successful strategy in building resilience among your staff during COVID-19? So choose one of some of those resources there. What have you done? What's been your most successful strategy? We love hearing from you. This is how we learn together and tap into each other insights. So I'd love to hear what you've got. All right, let's close the poll. All right, it sounds like most of you are expressions of gratitude. 56% said that that's what you are doing. Over communication, to keep informed, I think we've learned communication is certainly important. Access to counseling and support, 9% of you said that, and other practical support with giving some groceries. So let's try the second poll. And our second poll. What has been your biggest workforce challenge? So with empowered staff, we're thinking about what is the biggest workforce challenge that you've experienced? If you would answer, choose only one of those. Love to hear what you're wrestling with. All right, let's close the poll. Wow, we've got a tie, absolutely. Staffing shortages and finding the coverage. Staff fears, anxiety, and grief, another 36%. And then the emotional fatigue of staff. Wow, thank you for being transparent. Thank you for sharing your successes and your challenges. And are you ever in for a treat today? Because we've got two exceptional women that are here to talk about some of their experiences. And so I will invite Naomi McDermott and Susan Hansen, two exceptional social workers, to put their video cams on and to join me. So I'll start with Naomi first. Naomi is the Director of Social Services at the Jewish Home at Broccoli. She holds a master's degree in social work and a bachelor's degree in education. With almost 40 years experience in social services and elder care in New York and New Jersey. But she's also worked for many years in the fields of substance abuse and mental health in New York City. Naomi has been involved in various community organizations, including being a board member for two different not-for-profit substance abuse treatment programs in Bergen County, New Jersey. And currently, she's the Bergen County Chair of the New Jersey Quality Institute's Mayor Wellness Campaign, Conversation of Your Life, a statewide initiative to educate communities on advance directives. She served as chairperson for the Recreation Commission in her hometown and has been appointed to the Bergen County Juvenile Justice Conference. Susan Hansen has been a social worker in long-term care since 1997, working with a variety of populations. She has also partnered with Human Resources to support employee assistance programs. She's grateful to have worked for administrators who incorporated culture change principles into traditional nursing home care. She became an Eden Associate and a Crisis Prevention Interventions instructor in 2004. She has been in her current position at the Catherine and Charles Greenhouse Home for 7 months, which is exciting, not only because it's a new position for her, but it's a new community having just opened last October. So here's what I want to say. I know the incredible women that are CEOs of Jewish Home Family and the Hover community. And both of those exceptional women have given high commendation to these exceptional women. We intentionally chose two people with very differing perspectives and experiences. So Susan, I'm going to invite you first of all to kind of give us a picture of your Hover community and kind of what that community looks like. Just set the context for us to let us know kind of what Hover looks like. And then Naomi, after Susan, please feel free. Are you muted, Susan, maybe?
All right, sorry about that. Here I am.
Yeah.
Okay, so we're in Longmont, Colorado, suburb north of Denver. The Hofer Senior Living Community has been here for, gosh, I think our independent housing 40 years. There's an assisted living, but we're brand new. Our homes were just built finished in October, elder mid-October, and our building, we get 12 elders in each house. We're a campus of 5 houses, 12 elders for each house, and then 1 house is our administrative offices. And oops, now I'm going into Naomi's houses.
That's okay. Let's keep going.
Okay.
We'll keep playing.
So it's been interesting. We just built the new house, the first house, and really we're getting up and running, getting ready to move into the second house when the virus hit. So we put everything on hold, tried to take care of the folks we had, get in a good place. We've just now opened up the second house. So we're on the other end of the spectrum from Naomi. We are training new staff on the greenhouse way. We are bringing elders in isolation initially. And so some of them aren't even able to see their whole house where they're living at or the camp.
Wow.
So they're slowly getting off isolation and getting out. So you can see what the campus looks like. This is our front porches that are screened in, the living area, and then there's a shared courtyard.
Wonderful. Thank you, Susan. So Naomi, why don't you tell us about Jewish Home Family, a little bit different?
Well, we, first of all, our organization is 105 years old, so we've been around a long time, and we provide a full range of different services and care for our elders. We have 2 campuses in northern New Jersey, the one that I'm on, which is in Rocklee, New Jersey, and another one in Rivervale. In our whole range of services, we have a home care agency, we have a home modification program, we, until recently, had an adult day program. We have outpatient therapy. Our assisted living in Rivervale has memory care and regular, normal assisted living. Not that memory care is not normal, it's just a little different. In this building, we have what are, it's a traditional long-term care and subacute rehab building. And we are actually in the process of building a brand new subacute rehab building. We are a greenhouse legacy, well on our way. And recently, not by choice, not by licensure, and certainly not with warning, we have become more of a med-surg, critical care, intensive care, hospital-like environment in a blink of an eye.
Yeah, that's for
and
sure.
That's who we are.
Yeah, given your proximity to New York City, I'm not surprised that things have changed dramatically. So Naomi, you set me up for the perfect next question. When you think about what you've been through the last 2 to 3 months, what is one word, and we'll start with you, Naomi, one word or one phrase to describe what this has been like for you?
Well, that's a very funny question for me because I tend to use humor a great deal at work, and it became very quickly, very appropriately that what people asked me how I was doing, and I would say, I'm just having another day in paradise. And that stopped working really, really quickly. And in the last 3 months, I've made probably thousands of calls. I can't even tell you how many phone calls, how many people, and everyone says, how you doing? And it became real clear you couldn't answer fine. You couldn't say, okay. Did the best we can with what we got. They all just didn't work. And one day out of my mouth just popped, I'm living the dream. And that has been my tagline. I have been living a dream. And please don't think that means it's a nightmare. It's just very unreal. And what I have found by having that as my tagline is it lightens everything. And when I call a family to say they're on isolation, they're not on isolation, they're observation, they're not, anytime they say, and how are you guys doing? I say, we are living the dream, and it changes the mood.
Wow.
So that's my tagline.
I love the tagline. It's actually kind of a positive spin, so that words matter. Susan, how about you? Very different community, very different experience, but how has this been for you?
Well, I think I've just seen a lot of opportunities for kindness and compassion through all the anxiety and uncertainty. So that's what strikes me.
Compassion. I love that. And once again, a lot of positivity there. So my reality is I've been listening. I've been very concerned about caregiver resiliency. And I've been listening to webinars like crazy. And so to frame our conversation today, I've pulled some quotes that I thought would be helpful for you to react to. So the first one is this: the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. Here's my question. Stress, anxiety, worry, fear, those are normal reactions to this pandemic and all the stress associated. So talk about how this stress has manifested in your different communities. And Susan, we'll start with you, and then Naomi.
Okay, well, you know, it's interesting when this whole thing started. I had just done an in-service on mental health stressors and triggers so that our team could look at what they're seeing in our elders. And then, you know, I just kind of moved that into let's look at our own stressors and be aware of each other and give each other that support. So in doing that, I think the team has really come together. They're holding each other accountable if starting to be more tardy, starting to have different concerns. We have had a little bit of turnover. I think you can see people's anxiety in their eyes when you can't see the rest of their face, and the challenges with just wearing masks all the time. So yeah, and I think you have that anyway in this field, because we want to do so much for our elders. So it's just compounded.
Yeah, for sure. How about you, Naomi? What have you seen? How has it shown up?
Well, I've spent a lot of time looking at fear and anxiety, an enormous amount of time, and post-traumatic stress disorder, because we have the perfect breeding ground for it. And I think from my perspective, I've really taken a four-step process on this. The first is that I identified all the things, and then I actually started trying to understand what were facts and what were feelings and how we differentiate between the two, because people were allowed to feel any way they wanted to feel. And what we had is facts to try and help people through those feelings, because we should have been afraid. We should have been very afraid. We should have had anxiety. We should be feeling stress. We should be feeling all those things. But how do we take all those feelings and manage to function with them and live through it? So it's a very complex question, even though it sounds very simple. And I think just showing up, all of us, because the number one thing that has reduced my personal fear and anxiety is not going through this alone. I have a very tough time explaining to you what it's been like, but let me tell you, I have the joy of getting up every day and coming into a building and having people all around me get it. And that helps us all deal with those feelings.
Well, I appreciate what you said, that this is a normal reaction, and it would be odd if they weren't having that reaction. I listened to something, a webinar that said, let's shift it from what's wrong with me to what's happening to me, and to really better understand it from that frame. So let's move into a different quote. This is a Deepak Chopra. I'm a real fan of Deepak. Spread the contagion of empathy and compassion, love, joy, and equanimity, and put it into practice. So what are some of the things that you've done in your communities to provide the antidote to the contagion of COVID-19 and all the fear and the anxiety that you both have referenced that are associated with it? So Naomi, I'll start with you, and then we'll go to Susan.
Well, once we could identify it, and allow it to happen. The next step was to take some actions to understand what was happening and help people get through it. And some of them were emotional, but here some of them were very concrete. One of the first things we did is we made sure everybody was well fed. There were cafeterias. We took the cafe that our elders and their families used to be, turned it into a staff lounge. Potato chips, cookies, candies, coffee, everything we possibly could throw at people so that they could snack and be well fed, as well as our regular meals and all the food. So, and that's not just because we're the Jewish home, and we all want to feed you, but food was a thing. But then we had what I would call the Jewish home bodega, and if you're not from New York, that's a small little convenience store. We started selling toilet paper. We started selling bread. We started selling milk. We started selling eggs. Because even if the grocery had any, when people left here, if you worked 11 to 7, you know, at 7 o'clock, you're not going to go to a grocery. If I worked till 5, at 5 o'clock, I'd get there, there'd be nothing left. So we made sure that our people had their basic, simple things. We then started having inspirational moments as well. There were signs started showing up. Heroes work here. Heroes work here every day. Some homes said heroes live here. I mean, it just every time we turned around, we were reminded that showing up made a difference and mattered. The other thing we did is we made sure that people were safe. How we got PPEs, God bless our people. You know, our administrator, Sunny, sent a photo, and I hope she doesn't mind I'm telling this story, of a license plate, so that if the guy she was buying this stuff from in a parking lot kidnapped her, we'd know how to find her and rescue her. We sent money all over the world to get this stuff. And not only did we acquire the PPE and have it, but when you walked in the building, it wasn't someone, just anyone handing it out. It was the director of nursing, who certainly had better things. It was nursing management, who certainly had better things to do, that sat there and said, where are you working and what do you need? So that we could tell our staff who were showing up every day that they were safe and taken care of. One of our staff members is a barber, doesn't color hair, but he's a barber. We offered haircuts. We did everything to try and fill voids and make sure people knew that when they came here, they were appreciated, they were loved. And now the other big thing we're doing is we're listening, because we have to take the action and then support our people. There's an old saying about, let's hurry up and do something. I have found that the saying that I now need to is, let's hurry up and stop.
Wow. I love
Close
that.
our mouth and open our ears and our heart.
Well, that was beautiful. Susan, how about you? What are you doing at Hover?
So I want to tag off what Naomi's saying. I think one of the most important things is showing up, being there. We're all here together, and the power of normal. Whatever you're feeling is normal, giving that kind of unconditional support. We did, you might have seen pictures in the videos that went by about the Gratitude Project. And I was a little skeptical of it when I first heard about it, because I thought, how do you find gratitude in times like this? It's challenging, and it just brought out such strong emotions and so much good. We had giant Post-it notes we put all over the house, and there was one for every staff member, but also for every elder living there. And we each made an individualized note on what we were grateful for about that person. And see everybody walking around reading it. And I love the whole heroes work here. But what's nice about the Gratitude Project is that it was individualized. So I know that how I'm appreciated apart from somebody else. And I think that really matters, what you're bringing every day. We also, some of the clinical support team took classes. American Healthcare Association offers an 8-hour where non-nurse people can become temporary nurse aides. So I'm really happy to be able to do that, because I felt frustrated for years if you're with somebody and you can't just do a simple thing of helping somebody move a leg or take a bite of food. And now with this temporary certification, I'm allowed to assist the Shabazz. And they've said that they appreciate that. And I feel really a part of the team being. One more thing we did care boxes for all of our staff, and everybody donated different things that they thought would matter, kind of like what Naomi was talking about, making sure people have something to eat, something to drink, put in aromatherapy, put in little stress fidgets, whatever we thought might help them to get their own kind of little care package.
Wow, that's lovely. And you know, something that Naomi, you said about listening. This is my next quote. Emotion needs motion. So obviously the significance of being able to talk about your feelings and having someone to listen to. So how has your organization or you personally really been a facilitator of being that safe place without judgment to have some of those conversations and to be that good listener?
I think one of the unique things that the Jewish home family allows us to do is that we have created an environment where we are a family. And I don't just mean with our work environment, I mean literally. And families are a unit, and we talk and we laugh and we have fun, but we also unconditionally love each other. And I think as we watched this horrible, horrible wave of illness and loss, we had significant loss here. And our loss wasn't, yes, my colleagues who are emergency room physicians and I would tally notes of what happened. But they were people, and they were loved, and they were wonderful, the people who died in the emergency room, but they didn't know them for 10 years. So we have to mourn together as a family and celebrate, because it's very easy for us to look at how many people we lost, but for everyone that we may have lost, we saved a lot of them. So we allowing people and acknowledging that, and empowering them to share their story and their part of the view and their perspective. We were given such almost, I don't want to say ultimate authority, but the staff were so empowered to take an action and do something that it gave us the ability to feel and now share those. So one of the things that we're doing is we're making sure that everyone has the opportunity to share what they're thankful about and they're grateful for, but we're also going around and quietly talking to staff and then letting them tell us. I have heard some things that I will never unhear, and have been said things that I am so sorry somebody had to say to me, but I am so grateful I had the ability to listen, because it was there, and we can compartmentalize this in a crisis, but when we come back to problem management, which is where we're at now, if we don't process it, we're gonna lose it. And we don't have the ability to do a traditional support group, especially with all the different walks of life that live in our family here. But we do have the ability to love one another. You know, a lot of times when this started, everyone said, well, this is what you signed up for. No, it is not what we signed up for. We signed up for taking care of people, getting them better, or giving them the quality of life in this chapter. We didn't sign up to watch someone literally taking a bowling ball and knocking everyone over. And we need to process that, and we need to understand that, and we need to feel good that even if this is what happened, that we handled it with such style, grace, and dignity. One thing that I will want to make sure everyone understands is that it was everyone here that was so touched by it. Our activities team, they're the royalty of fun. They were doing Skype calls with dying family members who couldn't get here. We really did become their real families. Our aides who have such a deep knowing, they were the first ones who said to us, she's not eating right. something's wrong, long before a doctor, long before anyone knew. So really empowering them and acknowledging their feelings and celebrating their success quietly and openly, and having fun, by the way.
Yeah, and I'm going to explore the fun in a minute, but Susan, talk a little bit from your perspective.
Well, so we're on a little bit, you know, we're on the other end of the spectrum from Naomi, and I really respect what she's what her facility community is facing. We're looking at the fear of the unknown and just trying to be kind of sentries on the wall. I do think, like she was saying, the deep knowing. So our deep knowing of our elders, but also deep knowing of our shabazz, our nurses, and giving them that comfort to express whatever they need to express. One of the resiliency workshops, you might have been to the same one, talked about having a battle buddy. So we're encouraging people to get, because other people in it understand. Kind of like Naomi was saying, it's not what we signed up for. We're in a different place. So finding somebody who understands and checking in with them. So we want to make sure everybody has some kind of buddy, some kind of support system.
Oh, that's well said. What a great idea. And I wasn't on that one. But here's what I was on. One that said resiliency factors have been identified as meaningful work, a sense of community, long-term relationships, and recognition from families and the community at large. So how have you, your organization, and the Greenhouse core values kind of supported resiliency factors in the last 2 months? And you've kind of alluded to a lot of these things, but this would be where I want you to talk about the fun factor as well. So why don't you start, Naomi, and then we'll go back to Susan.
Okay. Well, one of the most fun events that we had was the first ever Jewish Home Family PPE fashion show. We were all given PPEs to take home and decorate. Now, these are disposables. We've just gotten in our reusables, but these were disposables. And the amazing things that people did, and the costumes and the ideas in the slides, there were some of them. And in the olden days, when we would have any kind of costume celebration, or we would have all the elders around, we'd invite them. But boy, we still had a fashion show.
Wow.
We still were us, and we still walked the runway, and we still did what we did, and then we wore the outfits and throw them away. So we had a lot of fun. When it looks at real home, because people were so sick, and we're still on total lockdown, we are still not allowed visitors, as I'm sure most of the universe is not. We had to become the real home if we weren't. Anyone who didn't, you know, this is where we had to be real home, we had to be real family, and meaningful life. This was a pandemic that our elders, thank God, a lot of them lived through, but we shared that experience with them because their lives mattered. And the meaningful life piece is, if that wasn't part of our core being before, and I believe it was, it sure as heck is now.
Wow, that's great. That's fabulous. And Susan, how about you?
Well, I think it's important to give people permission to still have fun, even though it's such a terrible crisis we're in, that it's okay to laugh and to be silly and to support each other that way. Our shabazz, I interviewed some of our shabazz in talking about resiliency and how we supported that, and they feel like just being able to direct that care, to have that voice, to really be at the center of everything has created control in a situation where you don't have much control. So they like being at the center of it and kind of directing us on what they might need and what other ideas they have to lighten things up as well.
No, I think what both of you are saying, and this goes to another quote that I learned from a webinar I listened to, healing happens best in the context of relationships. And it sounds like the trust, the transparency, and the culture in both of your organizations has really helped to really create an environment, a culture, if you will, for healing to take place. And Naomi, you've reminded us that there's more healing that will need to be done, but you're willing to listen and you're willing to create that openness, to lend a willing ear, to be that listener. So as we wrap it up and save some time for questions, I'd like both of you to kind of tackle, and Susan, I'll start with you and then we'll go to Naomi. What are top 3 recommendations? What's your lessons learned? And for people listening today on this webinar, what would be your top 3 lessons for them based on your experience?
I think self-care is all important. And I think, again, like you can have permission to have fun, I think we need to give people permission to take care of themselves. I think in this field, especially, to give it all and not step back and fill themselves back up again. So I think that's huge, and to let them know and to give them tools, and to take care of ourselves while we're doing that as well, to be that model of that. I think to not be afraid to show vulnerability is important. And I think to use your battle buddies, your support system. I'm on a weekly meeting with other social workers, situations, and just knowing that we're there for each other is important.
So before I transition to Naomi, you talked about self-care. So I'm going to ask you, what are you doing to model self-care, and what's your self-care go-to?
I think exercise is huge. I can't say I always want to do it, but I do it and I feel better afterwards, and getting really good sound sleep. When I come in the morning, I listen to Audible books on the way. And so I'm not at work until I'm at work. When I come into the office, I put on kind of a meditative music as I set my intention for the day and organize my thoughts and just kind of ready myself for the day that way.
That's awesome. So Naomi, give me your top 3 recommendations, and then we'll have you as well end with your self-care strategy.
Well, my top 3 recommendations, the first one is to ask for help. And you can ask for help in a million different ways. But the important thing is to ask for it. You can ask from a supervisor, a peer, a colleague, a friend. You can ask whatever higher power you believe in, or God. Just ask for help. And I have found when I was in the midst of this disaster, I didn't ask for anything. I just said, I need help, and I would get through it. So asking for help is my first thing. The other one is to remember to say thank you and be thankful. One of my nurses once said to me that she was very afraid to go to sleep because she was afraid she might not wake up. And this is a healthy person who's not virus positive. And we talked about how thankful we were just to wake up some mornings, to have a coffee pot that had coffee in it, clean drinking water, but just to be thankful and to say thank you. And the third recommendation is don't forget to live in the moment. Yesterday's gone, and tomorrow hasn't happened. And so many people are stuck on woulda, coulda, shoulda, and what am I going to do? And they forget about today. And really, today is all we have. And if this hasn't made that very, very clear, I don't know what else could. And that is, I used to be able to say, I'm a glass half full gal. I'm always going to look at the bright side. It's not half empty, it's half full. Now I'm just happy I have a glass. It's just, life got very simple for me. So I want to live in the moment, and that's a very ongoing challenge, but that's one of my 3 lessons learned. As far as what am I doing for self-care, well, I've always been neurotic about my diet and exercise, so I keep that up. But what I've done differently about my self-care through this pandemic is 2 things. One is that I have used an amazing support system that I have, some in healthcare and some not in healthcare, because I couldn't just focus on this. And I have a very loving family that has also always been there for me. But I also remember when I get in really, really black place is really, and see, I've even closed my eyes for those of you who can see really well, and it gets really, really dark. One of the mantras that keeps coming to my mind is when it gets so dark like that, if you look up, that's when the stars shine the brightest, and that's hope. So my self-care is never to forget that even in my darkest moment, and even when it gets pitch black, when I can see a shining star, it reminds me that, you know, I just have hope for a better tomorrow and a better now. So that's what I'm doing for self-care.
That's great. And that they say in the darkest night, the stars shine the brightest. So thank you for that. Both of you, these were tremendous words of wisdom. I'm going to invite my colleague, Marla DeVries, to join me. And I'm sure we've got some questions that have emerged during our conversation. And I'll turn it over to Marla to facilitate that.
All right, thank you. And we do have questions, and I encourage people to keep submitting them. I think some people were like me and I was taking notes and thinking. And so now you've got time to put some questions in. And a couple comments. So thank you for emphasizing having fun, laughing, and being silly. Such an important aspect of resilience. And another comment that you are all doing a good job. So thank you for that. So here's a question. What tangible things do you encourage your direct care staff to do in the flow of work? So meaning, you know, when they're in the middle of, you know, caring for the elders, during moments of stress and distress. What are the top tips to help direct staff cope in the flow of work during difficult moments? So when you can't step away from it necessarily, what advice do you have for helping them to deal with things in the moment?
Well, I think ask for help. I think, you know, sometimes our eye contact is all we have. So I think making that eye contact, asking for the help you need. I do encourage people, if they can step outside for a second. I know with the masks, with all the gear, sometimes just getting a breath of fresh air and then going back in, I think can be helpful to kind of refocus.
Nice. Center. Yeah. How about for you, Naomi?
For me, a lot of it is just being there, showing up. The idea that I walk onto a floor, the idea that I am there physically, the idea that other people who are non-caregivers physically are are present. Showing up is you know, so much of the battle. These were very scary times. This was very scary stuff. But you know, and we can't hug each other. In fact, that was one of the most fun things about some of the stuff we do, is that we can take pictures, and if you look at any of the pictures, we're next to each other. But remember, we're in full armor. So the idea that we can just show up and be there in the moment, and also when having these little mini panic attacks or anxiety attacks, reminding people that the moment passes, because it is only a moment. Mm-hmm. And if we can count to 10, we can get there. So I have to say, showing up and allowing people to be themselves. We're not heroes. We're human beings. You know, I can't tell you how many of the staff I've cried with when we talked about somebody who isn't with us anymore. And 2 months ago, none of us would have cried at work. It was a great show of weakness. It was a great show of you know, how vulnerable we were. But my God, if we didn't cry over this, it would have been wrong.
Right.
So, you know, showing up and being real.
I have to, oops, sorry to interrupt. I've heard from several of the Shabazz how much they appreciated just the extra support of us being there. So I agree with Naomi on that. I think just our presence there and knowing that they have that extra support is helpful.
Nice. And I think you both have talked about how having feelings is important, and it's not about really squelching those feelings. It's about giving people that space and safety to express them. So I think that's great. So here's a question. You both talked about ways that you practice self-care. How about There are some people that you say the word self-care and they don't really understand what that concept is because they are caregivers by nature. So how would you encourage somebody to start practicing some little ways for self-care when that's a foreign concept for them?
I've got an idea on that. I've asked people to identify one thing that they do just for themselves. And for some people, it is a big struggle. And they'll identify things that they're actually doing for somebody else. And I'm like, no, for you. What's that one? Start there with the day. And again, giving them permission and talking about how valid it is. Because a lot of people feel selfish taking that time. And so you have to work on that mindset of how it starts with you, and that's where you build your own strength.
I think in our world, the concept of self-care is just one that's a little too clinical for real world. It's very good for people who've had some kind of journey and some kind of work on it, but the average person in life, really, self-care is a really strange way. So I agree with Susan. I would never say, what are you doing for self-care? I'd say, how are you taking care of you? And keep it, make sure that the words you use matter so much. And we don't want to be, oh, no, it's not what I do. But making it a little more palatable, because a lot of people think it's a chore. And it's not. It's a joy. And I don't think we have to necessarily call it self-care. One of the things that we're doing with Project Get Outside a Little, we have some patios and some amazing, beautiful space. We're encouraging all different levels of staff to do this. Don't wait for activities to take someone outside. Take a group and go outside. You don't have, and doing that and having things outside is really going to be taking care of yourself. So not using a word that people can't relate to.
Right. Well, and
I've also heard it I've heard it referred to as self-full also, because you're filling your spirit back.
Nice. So it's not selfish, it's not a chore, and it's self-full. I like that. So here's another question. Have you seen examples of staff supporting each other, and what has this looked like?
Well, I can tell you that we are much better at taking lunch breaks now. And because we changed how our staff were eating, it forced them to come outside, because Wednesdays are wonderful here. Every Wednesday we have a special meal that's been donated from a local restaurant and foot the bill by part of the board of directors. So if we serve it outside, they have to come outside to get their food. And when they come outside, they're different people. So one of the things that we've done is tried to get them a little bit out of their shell. I think so that when people take breaks, we're not so concerned about just taking care of people now. We want them to also be able to take those few minutes and relax and not just jump up and down all the time. So allowing them to be themselves while they're here. They're no longer a crisis team. They're just being us.
One of my favorite moments was we use aromatherapy in our home, and seeing Shabazz share what she had learned about peppermint and how refreshing it was when you get tired, and her sharing that with her team member. And just so those little tips that they're learning, I like to see that kind of support.
Oh, that's a great story. So what has been the most challenging part of processing during and in the aftermath of the pandemic? What would you describe as the most challenging part? I think from a social worker's perspective.
That's tough. I'm not quite sure where to go. No, go ahead, Naomi. I'll let you take that one.
Well, there's been two things that have been unbelievably challenging. You know, the social workers here went over advanced directives with everyone immediately when this started and educated families and had conversations. And nonetheless, we lost a lot of people. So, you know, the most challenging has been processing what we've lost. You know, for everyone we lost, we saved far more, but we still lost them. The other biggest challenge in processing this is dealing with the real world. You know, I will never know, and my team will never know what it's like to be on isolation at home. We just will never know that. Just like you may never know we'll never know what we've been through. But the idea of trying to get back to normal and the idea of dealing with families who have not seen their loved one in 3 months and think that it's my fault that they can't come here and visit. I actually had someone call me. I'd like to know who I speak to at the Jewish home to be able to come in and see my mother. I said, Governor Murphy, he doesn't work here. So that has really been one of the greatest challenges of process and dealing with this is getting the families through it and getting them to understand what's going on here and how vulnerable our people still are. I mean, we're done with the crisis. We're in problem management, but this is all very fragile to us, and that's my warning to the whole world out there. This is an airborne pathogen, and every time we learn something, we realize we know nothing. So the real challenges are trying to bring back normalcy through this whole process.
Yeah, I would agree with that, and I think everything is opening up again on our team. They're wanting to go out and do things, and we're reinforcing the safety and that we're protecting our elders, and then moving new people in during this crisis and helping their families understand why we're doing what we're doing, and just getting the elders through that. They don't even know what their house looks like, and they're in this room, moved in, go straight into a room, and building the relationships during the crisis, I guess.
Yeah, I think we set this up to be, two very different stories. But you brought up the issue with families. Everybody is facing the isolation and the inability to visit. So what advice would you give to staff members who are either responding to families and as you mentioned, Naomi, sometimes, they're distraught, or to organizations to speak to family members? Anything you would add?
Well, the only thing I would say that has been very key in keeping families as calm as humanly possible in a situation where none of us have control is allowing them to say to me what they need to say. I have actually, and then when they say something that crosses the line, asking for help in dealing with it. But when I make calls, and some of the calls I make and have documents, just calling to tell you your mother's test was negative, and you'd think it'd be a 2-second phone call and all is okay. But the family, while I have you, and when this happened, in the midst of this crisis, I had called someone to tell them, and by the way, in the month of April, we moved 80 people around in this building, and I think we had a census of 110, and 80 room changes because you had to have well with well and sick with it was, and families would say, my mother doesn't have her favorite shoes, and you'd want to say, your mother's alive, she's fine, we're doing well, but you had to be a little kind about it. So dealing with people, they may not be experiencing what we're experiencing, but they're experiencing something that for them is equally as challenging.
Mm-hmm. Yeah, I think that's a great perspective. Susan,
yeah, I
anything?
agree. I think we have to just go out of our way to communicate with the families as much as we possibly can. Split it up and have people reach out, make those contacts, and then Zoom like crazy. We have weekly. Anybody can come on. The family members are connecting with each other through the Zoom meetings, so they're developing their own support systems. And then my mom, who's on this call today, she's learning Zoom. She's 88, so people are learning new things, and it's been a real lifesaver with this.
So to take your battle buddy idea, it sounds like family
Mhm.
members are getting their own battle buddies to
Right.
really provide that support. So you mentioned Zoom. Here's a question. Other than video calling, how are you keeping connections with families and elders? Any other ideas of how to keep them connected?
We're
Well,
doing
we've done
window
it.
visits. Oh, sorry, Naima, go ahead.
No, go ahead, Susan.
No, I was just saying, we're doing window visits here. So for the families that are local. So that's been kind of nice. And we've even had dogs come by the visits. I know it's not novel necessarily, but it's a great tool that they can actually see the smiling faces. And we're encouraging, card writing as well.
Well, we at the home actually built a visitor's tent at a different part of the building and have that connects to a window that is in another part of the building so that the families could actually come by appointment only, because it's a huge logistical thing, to see their loved one. And it's been interesting. Some people have said it's like a prison visit. I'm seeing them through glass. One elder got very, very angry and said, why can't my family, why are you doing this? Pointing to the family, why are you doing this? Why aren't you coming in to see me? So we've had, and other families are just delighted with it. So we've had everything. We've had and majority of our rooms don't have a first floor window that sees to the public. We have really evaluated our Skype calling to make sure, and our Zoom and all these iPhone things, to make sure that it is in the elders' best interest, not just the families, and evaluated how often do we need to do this. I had one family that had 14 children that didn't come to visit anyways, and each one, so we really had to look at what is in the elders' best interest, how do we keep the families okay, and how do we also allow our activities people to start having fun again? How do we make, rather than just be telephone operators? It played a very important role, but the idea that we have to keep them connected with the outside, but a 15-minute call with someone for 4 people in an hour, or having 6 people with social distancing trying to interact some way, you have to look at what's in the elders' best interest. We have been extremely transparent. Our emails that came from Carol, our executive director, have been extremely transparent, were co-signed by our medical director, came out with great regularity, and often if something came up, and then dwindled down to a regular rhythm when we stopped having crisis, and problem management. And I tell you, we miss a lot of the families as much as they miss us.
Mm-hmm.
So I'm going to do one more question. It says we are in very uncertain times without any notable end to the pandemic. What advice would you give to support and motivate caregivers over the long term? So speaking to, it's not that crisis, it's kind of this steadiness. So what advice would you offer to support and motivate caregivers?
I think with the caregivers that we have here, I think kind of back to the heart of this topic, the more we can empower them, the more control that they feel like they have in the house to support their elders, to support each other, to notice, like Naomi was saying, the little things that have changed, to partner with the nurses, to get that education, have that autonomy. Excuse me. I think that from what they're telling me, that is very important in how hopeful and positive they feel going forward.
Oh, yeah, you summed it up very well, Susan. I agree. Empowering the staff, but also reminding them of the other core values about this is all about a meaningful life. You are not a caregiver here. You're part of a family here. This is a real home. You know, this is what you do matters. I spoke this morning to some of our staff, and I explained to them, I said, you're turning and positioning people. When this went wrong, and you're making sure that our elders stay hydrated, that saved people's life, and what you did mattered. And reminding them that it's not just that we empowered them, but that they took the action. And it's all three of the core values. This is somebody's real home, and we are part of their real family, that we give people meaningful lives, their lives matter, and our staff are really empowered to be able to do that. And when I say really empowered, you know, a lot of our staff got sick, including our nurse management team. A lot of people here, 1 in 5 of us tested positive. I mean, that's the staff. We had to be empowered, and we were empowered that when this one was out, it didn't stop. And when this one is out, it didn't stop. And when this one got sick, it didn't stop. It scared us to death, but it didn't stop. So, but using all the tools that this approach gives us is what will keep people working in this amazing thing that we do. Of course, we do need some rebranding, but that's a different webinar.
So I call that synergistic transformation, that it really is all three of those elements together. And so I'm going to end this Q&A and turn it back to Susan with, ladies, what you do matters. So thank you very much.
Thank you.
Couldn't agree more. I mean, that was powerful. It's like a drop the mic moment. So thank you for providing your words of wisdom. You both come from exemplify organizations where culture is based on those incredible values and trust, transparency. It's all so much there. So thank you for that. And now just to talk a little bit about some things coming up. I hope you've enjoyed this one. Naomi referenced a lot of the things that they were doing at the Jewish Home Family. If you missed our first session in the Elevate series, you should go to our website so you can find Carol Silver Elliott and Eric Regrer, the Director of Nursing at Jewish Home Family, so you can listen to that one. But here's what's coming next. Next Thursday, we've got Wendy Ben-Narshik from John Knox Village, Steve McAlilly, President and CEO of Methodist Senior Services, and Maren Canton. They're going to talk about workforce recruitment and retention. And if I remember the poll, this would be something that sounds like it would be very meaningful to you. And going forward, we have person-centered care and COVID on June 18. We're going to kind of put this all together. Marla and I are going to really kind of put together and synthesize everything that we've heard, all those person-centered concepts that we have learned about through all of our incredible guest speakers on this webinar series. And you can go to our website to learn more about this series. And like I said, to go back and listen to those that you haven't. You'll need to register in order to get those links. We do have a workshop if you want to learn more about the Greenhouse Project, the Greenhouse Model. Attend a virtual workshop, and we've got a virtual workshop coming up on June 17. All done virtually. It's a 10 to 4 engagement. We've got built-in time, but we hope that you'll join us for that workshop. In addition to that, we are going to partner one of our sponsors, IN2Well. We're going to celebrate CNA Week. We're going to celebrate the exceptional men and women who are really, truly working on the front lines. We want to toast their heroism and their dedication, and IN2Well is coming behind us and really with a desire to support those CNAs that have been on the front lines. We have a webinar coming up. Lori Porter, she leads NACA, the National Association for Home Care Assistants. She's going to really tell us what it's like to appreciate CNAs and really tells it like it is. If you've heard Lori speak before, you'll not want to miss this webinar on June 22. But wait, there's more. Coming in July, we are doing a virtual learning lab to really work with you to change the culture and transform the care. So stay tuned. We're going to have the date next week on our webinar. we'll be able to tell you exactly when that's coming, and we'll unpack that a little bit more for you. So thank you so much, everyone, for your time, for your attention today. Naomi and Susan, I am indebted to you. Thank you so much for sharing your words of wisdom. Take care, everyone, and we hope you'll join us again next week.